Now, on today's Focus on Health, Mississippi is now among the states with the highest flu activity. Dr. Timothy Quinn, he's going to join us this afternoon or right now to talk about where the Jackson metro area stands in the latest flu activity and also how you can stay protected. So as always, Dr. Quinn, thank you so much for joining us. Talk to us. Now, symptoms of the flu, they tend to come on suddenly, includes fever, muscle aches, chills, and sweats. Those are just some of the symptoms. Children may also have vomiting and diarrhea. But what are the other ways that people can know if they potentially have the flu?
Well, the problem with the flu is it can present in so many different ways, like you're explaining right now, depending on the person and that specific case. So you can't just look for just specific symptoms. But if you're feeling really ill, runny nose, cough, sore throat, congestion, you need to go visit your medical provider to get tested to make sure you don't have the flu. Because the good news is there's an antiviral medication that is very helpful, but it has to be prescribed in the first couple of days for it to really work well.
And talk to us about treatments. That's so important too.
Right. As I was saying, there's a medication. It's an antiviral. It's not an antibiotic. The flu is a virus. And if you can get on this medicine in the first couple of days, it works really well. But also your medical provider will also provide you some symptomatic treatment in most cases, such as a cough syrup, a decongestant, and some doctors will even prescribe an antibiotic just in case you get what's called an opportunistic infection, where your body is weak fighting the flu, and then that bacteria just jumps in there and you can get pneumonia, and it could be deadly, especially if you're someone that's immunocompromised or elderly or have chronic medical conditions.
So what are some simple ways that you can tell people to protect themselves? How can they protect themselves?
Well, of course, get your flu shot and understand that COVID is back. So some people are getting flu and COVID at the same time. So get your COVID shot as well. And if someone is sick, maybe stay home. Don't go to work and expose everybody else. Go get tested to make sure you're safe before you go back. And, washing hands. And if you're somebody that's elderly or immunocompromised, maybe go back to wearing masks, avoid large crowds, and just be safe.
All right, Dr. Quinn, is there anything else real quickly that you'd like to add that I haven't asked you?
If you haven't gotten your flu shot, it's not too late. Go ahead and get that flu shot and get your COVID shot if you have not already done so.